So the Camden Coalition is partially a local organization and partially a national organization. So can you talk a little bit about
Yes.
that? Welcome to Health Hats, the podcast. I'm Danny Van Leeuwen, a two-legged, cisgender, old white man of privilege who knows a little bit about a lot of healthcare and a lot about very little. You'll listen and learn about what it takes to adjust to life's realities in the awesome circus of healthcare. Let's make some sense of all of this. Thank you.
We started as a local organization because Jeff Brenner, our founder, was a physician who, very much like Dave Rubin, was frustrated that his work wasn't doing a damn bit of good. That seems to be the common theme in I guess the next job I'll get is going to be some doctor who comes to me and says, I feel like my work isn't doing a damn bit of good. But anyway, Jeff actually, within the Cooper medical system, created this model of the nurse and the social worker and the community health worker to leave the hospital, right? That's really important. And go see clients where they were. And the most complex clients with medical complexity and social complexity. And so we did that, and we were very lucky. And I say we were very lucky because I know all too well that there are thousands and thousands of community-based organizations doing incredible work like the Camden Coalition. The fact that we were singled out by Atul Gawande in a New Yorker article is luck to some extent. We hold that with a lot of humility here. But it gave us this opportunity to have a national point of view, right? Which is not a typical thing for a community-based organization. And I say, again, that's a little bit of power that this community-based organizations have, and so we must use it wisely and be generous and share it.
I now have one URL for all things Health Hats. That's linktree/Health Hats, spelled linktr.ee/Health Hats, one word, to subscribe for free or with a contribution through Patreon. You can access show notes, search the 600-plus episode archive, and link to my social media channels. Your engagement by listening, sharing, and commenting makes quite an impact. Please visit linktree/Health Hats. Thank you.
Through that, we really started to talk to other groups around the country that were doing the kinds of things that we were doing. They might have even done it ahead of us, right? They were ahead of us. And the idea of bringing people together in a sort of home for the field of complex care was developed with the Robert Wood Johnson Foundation and AARP at the time. And so we built this national center and the conference that you came to. And we wanted it to be, certainly for me, not like the academic medical conferences that I attended for 10 years. And I wanted it to be a little bit of that, but I didn't want it to be all of that. And I wanted it to be a little bit of the children's advocacy convenings I went to in New York City, which were sometimes with ACT UP in the room because it was the time of the AIDS crisis, and sometimes it was a room filled with family daycare providers, but we really spent a lot of time thinking about diversity of voice. And I think you saw that in Boston. And we continue to get support from the Robert Wood Johnson Foundation to have a national center that is really here to push out information about the field of complex care. We do teaching, we do training. We just launched a new certificate on complex care, which we hope will be a way for other providers to really bring the diverse teams that are working on complex care in their program or institution, or even across programs. And for people to learn and people to learn together and skill up together.
I host, write, and produce Health Hats the podcast with assistance from Kayla Nelson and Leon and Oscar Van Leeuwen. Music from Joey Van Leeuwen. I play Barry sax on some episodes alone or with the Lechuga Fresca Latin Band. I buy my hats at Selma Gundy, Boston, and my coffee from the Jennifer Stone Collective. Links in the show notes. I'm grateful to you who have the critical roles as listeners, readers, and watchers. Subscribe and contribute. If you like it, share it. See you around the block.